I'm a chiropractor. I'm located in Southampton at Natural Health Chiropractic. I'm a second generation chiropractor. My father, Dr. Joe, started the practice in 1995. I love that I get to continue the great work that he did, and I get to hear firsthand all of the people that he's helped over the years, which has helped grow my admiration for him even further. And I look forward to having my own two daughters involved in my practice in any way possible if they choose to do so. So what is chiropractic? Well, the word directly translates into practicing with your hands. So that's what I do. I practice medicine with my hands. I provide manipulation and muscle relief into an area that is not moving properly or that is bothered by aches, pains. I've just like what Charles was saying with looking at it from the screaming baby analogy, absolutely. You want to target all the things that can cause that pain, because most of the time it's not right at the site. It's elsewhere, or it's a combination of things. So we first look at what's wrong. We're able to diagnose. I'm able to send out for any imaging that's required. I don't over image. I don't think it's necessary to have a radiograph for every patient. I think it's more important to not be radiated regularly. So I use history taking, manual observations, and hands-on orthopedic testing to just give an assessment of what's wrong and what is the areas that are actually affected. From there, I move into my treatments, which is what I love the most, helping people feel better. I get my hands on the area. The hands are a powerful healing tool, and it's often not utilized. It's one of the first steps on the ladder of recovery. You know, some self-care, which most people are not aware of. So that's where practitioners like us come into play, where we can educate you on how to take care of yourself to be your first rung on the ladder. And then manual therapists are the second rung on the ladder. Anybody that's helping provide more movement to an area, or hands-on circulation to an area, or helping unblock channels that are clogged, pathways that are clogged. So I get in there with my hands and I loosen up the muscle, because the muscle's pulling on the joints, and it doesn't matter if it's the back, the neck, the shoulder, the elbow, the knees. It's all bound by muscle, ligaments, and tendons, and I get in there and I work it out. We get it so that blood's in the area, get some oxygen to the area, loosen it up, and then provide some motion into the joint. I have several ways of doing so. First and foremost is a traditional chiropractic adjustment. Often in that mode, you'll hear an audible release, and it feels great right away. You feel like this neurological response, and you feel light. And it's a very effective tool for putting motion into a joint and moving things back to where they need to be. However, it's not comfortable for everyone. In fact, it's not comfortable for a lot of people. So we've kind of become an alternative chiropractor, in that I have a lot of other tools that I use for people that don't feel comfortable with the more traditional chiropractic adjustment, especially in the neck area. It's very vulnerable, and I respect that and can appreciate that. So I have other tools to help move a joint. I have my little adjusting gun, for instance, or traction therapy with my hand, traction therapy with my table, where it just helps to decrease the tension in the joint. Teaching you how to move your own joints using things like a foam roller, or just some basic movement patterns to help put the motion into your joints. And oftentimes, just by relieving the muscle tension, and especially with what I do, and then incorporate it further with massage therapy to really keep the muscles nice and loose, you can relieve the tension on the joints, and you don't even need anything too aggressive to begin with. So from there, I go into an education mode where I'm teaching you how to do the exercises and stretches that you'll need to do to help this area heal further. You are the center point of the healing process. You just need myself and other practitioners like at Airmid Wellness to teach you how to do it, to help you tap into that ability yourself. And so I look forward to being part of that process, and I look forward to teaming up with my friends at Airmid and really wellness practitioners all around. I think it's important that we're all working together, realizing that not one of us is the whole part. We're just piece of the whole part. And so I really appreciate you listening to what we have today, and thank you for including me in this presentation, and I look forward to working with you in the future.